Everyone one year boy Ryan Sem Nankasamua na accountability series Jumedia Koso and a day. Now so for show ya pomu de hon sem so nimnya for kwabena minta akando akasa dia for my Ghana ya pomu de hon ensensem.
Country is striving towards universal health coverage, the assurance that all people can access the health services they need when they need them without suffering financial hardships, and Ghana is no exception. Whilst it is true that Ghana has made important progress over the years, we still have a lot of work to do. Our universal health coverage index now stands about 56%, and we need to hit a target of 80% by 2030. Over the years, several governments have attempted to move Ghana closer to our universal health coverage target through several targets and 2 reforms, and these are the CHIPS Compounds Program and the National Health Insurance Scheme. Despite these efforts, we must also be honest. Too many Ghanaians are still not fully protected. Only about 2/3 of the population is actively enrolled in the National Health Insurance Scheme. That means a significant proportion of our population still faces financial barriers at the point of care. Out-of-pocket payments still account for roughly 1/3 of total health expenditure. In practical terms, this means many families are still paying out-of-pocket before they can receive care and run the risk of catastrophic expenditure. Ladies and gentlemen, this is the danger. When people have to pay, they delay, they wait, they try to manage symptoms at home. And by the time they come to the facility, the condition often worsened. Now let us consider what this means for the health of our population. Ghana is facing what we describe as a triple burden of disease. We continue to manage infectious diseases, but at the same time, we are seeing a steady and significant rise in non-communicable diseases such as hypertension, diabetes, cancers, stroke, and mental health conditions. What is particularly concerning is that awareness of these conditions remain low. Many people do not know their status. This is problematic because hypertension develops silently, diabetes progress quietly, and certain cancers show no early symptoms. So people are living with these conditions without knowing until complications occur. For example, data from a study in 2021 indicates that only 35% of hypertensives in Ghana were aware they had high blood pressure. What this means is that for most people, by the time they enter the health system, they are presenting with stroke, kidney failure, advanced cancers, or severe complications. At this point, treatment becomes more expensive, more complex, and less effective. This is why we are seeing increasing morbidity from chronic conditions and why non-communicable diseases now account for a growing share of deaths in our country. These conditions should not be fatal when detected early, but when detection is late, outcomes worsen. At the same time, we must acknowledge system realities. Access to services is still uneven across communities. Some communities are well served, while others still face distance and availability challenges. Many primary healthcare levels facilities do not yet have all the equipment required to deliver the full range of essential services. Indeed, data from nationwide survey covering about 60% of our health facilities showed that only 5% had a full complement of basic equipment